Breaking this morning, Pfizer says its COVID-19 vaccine works for kids ages 5 to 11, and they now plan to seek authorization for this age group soon. Thanks for joining us for this special edition of Up with Krem. I'm Tim Pham. Researchers say the shots produced an immune response and side effects comparable to those seen in a study of people ages 16 to 25. Right now, the COVID-19 vaccine is still not available for children under 12 years old, but a plan is in the works to get one approved by Halloween. This morning, we are taking a closer look at the possible timeline, and many parents are wondering if the vaccine will be safe for their kids. Nicole Hernandez took your questions to a local family doctor. She's live in Spokane this morning. And Nicole, what are those doctors saying to you?
Yeah, Tim, so there's a lot of misinformation about the COVID-19 vaccine circulating right now. So I'm live right now in the hospital district here in Spokane, and I talked to a doctor who works here at Multicare. Her name is Dr. LaSalle. She said that the COVID-19 vaccine is perfectly safe for children. So she said the COVID vaccine has gone through the same, if not more, oversight than other vaccines. Plus, scientists just know how our bodies work with vaccines. No matter what vaccine you get, your immune system basically does the same thing. It builds antigens to help you fight off the virus. So we've had decades of experience with vaccines for viruses like polio, chickenpox, and measles. None of those vaccines have had long-term side effects years down the line. Dr. LaSalle says what parents should be concerned about is long-term side effects of COVID-19. We know chickenpox can cause shingles, we know measles can cause a deadly neurodegenerative condition, and we're already seeing people with long-term COVID-19 symptoms. So Dr. LaSalle is suggesting all her families vaccinate their kids.
We're seeing more and more pediatric hospitalizations, infections, and serious outcomes with the Delta variant. And so it's just as important that kids get vaccinated as it is that adults get vaccinated. If we're going to reach that herd immunity threshold, which is now north of 80% of the population vaccinated, we've got to include kids in that.
So coming up in the next half hour, I actually spoke with 3 teenagers who all got fully vaccinated to help their immunocompromised dad. They're grateful that they made that decision. They're hoping others do the same. In Spokane, I'm Nicole Hernandez.
Right now, children 12 and up can be vaccinated, but why is this process taking longer for younger children than initially expected? The FDA asked for 6 months of follow-up safety data instead of the 2 months it asked for with adults. It also asked Pfizer and Moderna to double the number of children ages 5 to 11 in clinical trials. Pfizer says they will apply for emergency use authorization sometime in October. Well, for the first time in a year and a half, the nation's largest school district returned to in-person learning last week. Right now, there are vaccine mandates for teachers and staff, as well as mask requirements.
I think what's important is where we agree. And we all agree that the best learning happens in person between students and teachers. And we have done the work to get our buildings safe.
In New York City, roughly 75% of school staff and 65% of eligible students are vaccinated. Well, to Los Angeles, now home to America's second largest school district. Earlier this month, the school board members voted unanimously to make COVID-19 vaccines mandatory for all eligible students. And that means any kids 12 and older have to be vaccinated by Thanksgiving if they want to attend in-person classes. Los Angeles County recorded more than 190,000 COVID cases in kids ages 17 and under since the start of the pandemic. Meanwhile, there is no vaccine mandate for Washington students yet. School policies for COVID outbreaks are complicated, and some schools have different quarantine rules when it comes to students who are vaccinated versus those who are not. On the west side in Thurston County, students who are unvaccinated and have close contact with a positive COVID case will be sent home for 2 weeks, regardless if they have COVID symptoms.
It's a practice of safety, and if a student hasn't been vaccinated, they may be carrying the virus and be more contagious.
Students who are vaccinated, however, can return to school if they are asymptomatic. Medical Lake School District is reporting almost 300 potential coronavirus cases. The district superintendent says about 300 staff and students are currently being tested for the virus. Officials believe that the spread came from inside the high school as well as through community members. School officials are asking students to monitor their symptoms and stay home if they're feeling sick. Well, with kids back in school and COVID cases on the rise in children, a lot of you have been asking if a minor needs parental consent to get the vaccine in Washington. KREM 2's Mark Hanrahan spoke with several Washington legal groups to verify.
As a child, a minor in the state of Washington, do they need their parents' consent to get a vaccine, specifically the COVID vaccine?
Yeah, so for all vaccines, generally the answer is yes, they need parent consent if they are under 18.
However, there are some exceptions. The mature minor rule allows healthcare providers to treat minors as adults based on assessment and documentation of their maturity, or if the minor can get legally emancipated from their parents. So we can verify that yes, minors can get vaccinated without parental consent, provided they go through some legal hoops to get there. So let's take a look at the current vaccination numbers in our area. More than 61% of Washington is fully vaccinated against COVID-19, which means they are 2 weeks past their last vaccine dose. In Idaho, less than 45% of the population are fully vaccinated. Currently, Idaho hospitals are in crisis standards of care due to rising COVID-19 hospitalizations across the state. That leads us to our question of the morning, and we want to hear from you. Do you think children under the age of 12 need to get their vaccine against COVID-19? You can vote in our live Twitter poll or text us your thoughts to 509-448-2000, and we'll be looking at your responses all morning long. Right now, a lot of people saying yes, and some people saying no. So again, weigh in and text us your thoughts. Here at KREM, we are dedicated to bringing you more to every story. For the latest on the Pfizer vaccine for children under 12 years old, you can text the word vaccine to 509-448-2000.